If your doctor told you that high blood pressure comes from too much salt and too much fluid, they were not wrong. But here is the uncomfortable truth. They were not telling you the whole story either. And that gap, that missing piece between what you have been told and what is actually happening inside your body, is exactly why millions of people wake up every morning, take their medication on time, see normal numbers at their checkups, and still end up in the emergency room with a stroke. Think about that for a second. The numbers looked fine. The doctor said everything was under control. The prescription was filled every single month without fail. But the stroke still happened. So what went wrong? It happened because the treatment was controlling a number, not repairing the damage. Now picture this clearly. Your car's check engine light suddenly turns on. Instead of taking it to a mechanic, you reach under the dashboard and cut the wire to that light. Instantly, the warning disappears. No more signal, no more stress. You drive away thinking the problem is solved. But the engine is still broken. In fact, it is getting worse with every mile. You just cannot see it anymore. That is exactly what is happening right now for tens of millions of people dealing with high blood pressure. And let me be clear, this is not about fear. This is not about distrusting your doctor. But the reality is, if you are here listening to this, it means you want to understand what is really going on inside your body. And honestly, you deserve the full picture. Years of observation have shown something deeply frustrating. People follow the rules. They take their medication. They reduce sodium. They attend every follow-up appointment. On paper, everything looks perfect. But slowly, quietly, their condition still declines. So the question becomes unavoidable. Why? The answer does not sit in the standard quick office visit. It lies deeper, at the cellular level. 3 specific mechanisms, happening silently inside your arteries, continue damaging your body even when your numbers look controlled. 3 hidden forces, working in the background. And once you see them clearly, everything starts to make sense. Before diving into those mechanisms, you need to understand one critical mistake in how we think about blood pressure. Most people believe it is simply about pressure, too much fluid, too much sodium. So the solution seems simple. Take a pill, cut the salt, lose some weight. But the truth is, that explanation is dangerously incomplete. Imagine an old garden hose. It has been sitting outside for 15-20 years. The material is cracked, stiff, dried out, and brittle from the sun. Now you turn on the water, even at normal pressure, the kind that would flow perfectly through a brand new hose. This old hose begins to struggle. It leaks, it cracks. The flow becomes uneven. So what is the real problem? The water pressure or the condition of the hose itself? That distinction changes everything, because most treatments today focus on lowering the pressure. But the real issue lies in the hose, your arteries, their flexibility, their strength, their ability to handle blood flow the way they were designed to. And here is the critical point. 3 specific mechanisms are slowly destroying that flexibility in most people as they age. The first one begins in a place almost no one talks about. Inside every blood vessel in your body, there is a delicate structure called the vascular endothelium. Think of it like the inner wall of a river, smooth, protective, and incredibly important. This layer is not just passive, it acts like a sensor. When blood flows across it, it sends signals deep into the vessel wall, telling it to relax and expand. The key messenger for that signal is a tiny molecule called nitric oxide. Remember that name, nitric oxide. When the system works properly, your blood vessels stay flexible. They expand under pressure. They protect your organs from damage. Everything flows as it should. But here is where things start to break down. 3 silent factors begin attacking this protective layer. First, elevated blood sugar, not necessarily diabetes levels, but even repeated spikes after meals, above 140, can trigger a process called glycation. And really, the simplest way to understand it is this. Sugar starts sticking to and damaging the proteins that make up this protective lining, slowly, like rust forming on metal. Second, chronic low-level inflammation, not the kind you feel, not pain or swelling, but a silent, ongoing irritation inside your body, driven by processed food, poor sleep, and metabolic imbalance. It moves through your bloodstream like sandpaper, constantly wearing down that inner surface. Third, Oxidative stress. Free radicals, unstable molecules created by stress, pollution, poor diet, and even normal aging. Over time, they attack the cells of your blood vessels the same way oxygen corrodes exposed metal. And here is the part most people never hear. When this protective layer is damaged, two things happen at the same time. First, your body loses its ability to produce enough nitric oxide. That means your vessels cannot relax properly anymore. They stay tight, constricted, under constant tension. Second, the exposed vessel wall becomes vulnerable. Inflammatory particles, cholesterol, calcium, they all begin to invade. This is where plaque forms. This is where arteries harden. This is where flexibility disappears. And once that process starts, it does not stop just because your numbers look normal. Here is the blunt reality. No blood pressure medication repairs this layer. Not one. They help manage the pressure. Yes. And that matters. But the underlying damage continues quietly in the background, and that is just the first mechanism. The second mechanism is something far less obvious, but just as powerful. And really, what makes it dangerous is how invisible it is. A few years ago, there was a patient, 68 years old, a retired engineer. Precise, disciplined, the kind of person who tracks everything. His blood pressure was sitting at 158/96. Not extreme, but clearly not controlled. He had been on medication for 6 years. He brought in his food journal, and honestly, it looked clean. Low sodium, plenty of vegetables, minimal alcohol. He exercised 3 days a week. On paper, he was doing everything right, but something did not add up. So a deeper panel was run, including one marker that almost never gets checked in routine visits: red blood cell magnesium. The result came back significantly low. Now here is what most people believe about magnesium. They think it is just something you take to sleep better, maybe to relax a little. But the truth is, magnesium is one of the most critical minerals in your entire cardiovascular system. Here is why. Your arteries are lined with smooth muscle cells. These cells are constantly working, contracting and relaxing to control blood flow. And magnesium, at the cellular level, acts like a key. It unlocks those muscle cells, allowing them to relax. Think of magnesium as a natural brake on vessel constriction. When magnesium levels are optimal, your arteries stay flexible, responsive, balanced. But when magnesium drops, and this is where it gets serious, those muscle cells lose their ability to fully relax. The vessels remain slightly tightened, all the time. And that constant tension drives blood pressure up. Now here is the alarming part. Studies suggest that more than 45% of adults are deficient in magnesium. And that number rises sharply with age. But it gets worse, because in older adults, 3 of the most commonly prescribed types of medication actually make this deficiency worse. Diuretics, often used to treat high blood pressure, flush magnesium out through the kidneys, along with sodium. So while they are lowering fluid, they may also be deepening one of the root causes. Proton pump inhibitors, commonly used for acid reflux, reduce magnesium absorption over time. Quietly, steadily. And then there is stress. Chronic stress increases cortisol, and cortisol accelerates magnesium loss from the body. So even if your diet is decent, stress alone can drain this mineral over time. The result? A silent deficiency. Running for years. Never tested. Never addressed. But all the while, your arteries are losing their ability to relax. Now here is what happened in that case. Magnesium glycinate was introduced, a highly absorbable form, gentle on the stomach. Within 10 weeks, blood pressure dropped to 138/84. Not dramatic, not instant, but real, measurable, and achieved without changing anything else. That is the key point. The mineral itself is part of the mechanism. The deficiency is part of the disease. And yet, it is one of the most overlooked factors in cardiovascular health. Now, if that was all, it would already be significant. But there is a third mechanism, and honestly, this one is often dismissed the fastest, even though its impact runs deep. We are talking about stress, Not just emotional stress, but the biological chain reaction it triggers inside your body. And the connection between stress and blood pressure is not soft science. It is not secondary. It is a direct, measurable, cellular process. Here is how it works. When your brain perceives a threat, real or imagined, physical or emotional, it activates a system called the hypothalamic pituitary adrenal axis. Your body releases cortisol and adrenaline. Your heart rate increases. Your blood vessels constrict. In the short term, this is survival. It prepares you to act, to respond, to protect yourself. But here is the problem. In chronic stress, this system never turns off. It becomes a constant background state. And over months, over years, elevated cortisol begins to damage your cardiovascular system in very specific ways. First, it suppresses nitric oxide production. Remember nitric oxide from earlier? The molecule responsible for allowing your vessels to relax? Cortisol interferes with the enzyme that produces it. So if you are under constant stress, your vessels stay more constricted than they should be. Second, cortisol increases sodium retention in the kidneys. It sends signals similar to another hormone, telling your body to hold on to sodium. And water. More sodium means more fluid. More fluid means higher pressure. Third, and this is the one that surprises most people, chronic stress accelerates arterial stiffening. It increases inflammatory markers that break down the elastic fibers in your vessel walls. In simple terms, stress makes your arteries age faster. And here is what makes this especially important. In older adults, this stress is not always dramatic. It is not always obvious. It is often quiet. The lingering grief after loss. The loneliness of living alone. The constant worry about health. The subtle anxiety that never fully goes away. These experiences are real, but more importantly, they are biological. They are actively shaping what is happening inside your blood vessels every single day, and yet, they are often dismissed. But here is the truth. This is not hopeless, because just like the other mechanisms, there are specific ways to intervene. Not vague advice, not just relax, but real, measurable actions. And in the next part, those steps will be laid out clearly, step by step. What you can actually begin doing this week. Now we come to the part that truly matters. What you can actually do about all of this. But before going any further, something needs to be absolutely clear. This is not a replacement for your medication. If your doctor has prescribed blood pressure medication, you continue taking it. What this approach does is target the deeper structural, cellular, and metabolic causes that medication alone does not fix. Over time, as your body responds, you work with your physician to reassess. You do not adjust anything on your own. Now, let's build this step by step. The first step, protect and restore your endothelial lining. The goal here is simple in theory, but powerful in effect. You reduce the three forces damaging that inner layer: blood sugar spikes, chronic inflammation, and oxidative stress, while giving your body what it needs to repair. And really, it starts with one practical rule. Pay attention to what happens after you eat, because the damage from blood sugar is not just about fasting levels. It is about spikes, repeated surges after meals, quietly stressing your blood vessels. So the adjustment is not extreme dieting, it is awareness. Reduce high glycemic foods, white bread, white rice, sugary drinks, pastries, sweetened cereals, especially in the evening. Replace them with whole foods that slow absorption, legumes, non-starchy vegetables, berries, moderate portions of whole grains. And here is something simple, but highly effective. A 10-minute walk after your largest meal. That alone has been shown to reduce post-meal blood sugar spikes by 20 to 30%. Not by burning calories, but by using your muscles as a sink, pulling glucose out of the bloodstream before it can damage your vessels. For inflammation, increase omega-3 fatty acids. Fatty fish, 2 to 3 times per week. Salmon, sardines, mackerel. Use extra virgin olive oil as your primary cooking fat. Add dark leafy greens daily. Not occasionally, daily. And for oxidative stress, color matters. Vegetables and fruits rich in color are not optional at this stage of life. They are functional. Berries, especially blueberries, contain compounds that directly improve endothelial function. Aim for 1 cup daily. Even dark chocolate, at least 70% cacao, contains compounds that help boost nitric oxide. A small square per day is not indulgence. It is support. The second step, restore your magnesium levels. And here, precision matters. Not all forms are equal. Magnesium glycinate and magnesium malate are among the most bioavailable and gentle on the digestive system. Magnesium oxide, common and inexpensive, is poorly absorbed. For most adults, a target of 300 to 400 milligram of elemental magnesium per day is appropriate. Split the dose. Half in the morning, half before bed. The evening dose has an added benefit, improving sleep quality, which in turn lowers cortisol and supports blood pressure regulation. But there is one important caution. If you have kidney disease, you must consult your doctor before supplementing, because your kidneys regulate magnesium levels, and impaired function changes how your body handles it. Also, if you are on diuretics or proton pump inhibitors, monitoring becomes even more important, because depletion may be ongoing, and long-term support may be necessary. The third step, rebuild your nitric oxide system. 2 simple interventions, but incredibly effective. First, dietary nitrates. Your body can produce nitric oxide from compounds found in food. One of the richest sources, beets, beet juice, or concentrated beetroot powder. Daily intake of 200 to 300 milliliter of beet juice has been shown to reduce systolic blood pressure by 4 to 10 points. That range is comparable to some medications. Other helpful sources include arugula, spinach, celery, and pomegranate juice. These are not trends. They are raw materials your body uses to restore function. Second, nasal breathing and humming. It sounds almost too simple, but the science is clear. Your nasal passages actively produce nitric oxide. Breathing through your nose increases its levels in your bloodstream, and humming creates vibration that can amplify nitric oxide production up to 6 times compared to quiet breathing. A simple daily habit, 5 minutes in the morning, slow breathing through the nose, with gentle humming on the exhale. Accessible, free, and effective at any age. The fourth step, address the stress mechanism directly, and this requires action, not just intention. First intervention, structured slow breathing, 6 breaths per minute, about 5 seconds in, 5 seconds out. This activates your parasympathetic system, lowers cortisol, and measurably reduces blood pressure. 10 minutes per day, consistently. After 8 weeks, reductions of 6 to 8 points systolic have been recorded. Not dramatic, but real, and cumulative when combined with everything else. Second intervention, progressive muscle relaxation before sleep. Nighttime cortisol plays a major role in morning blood pressure spikes, so before bed, spend about 15 minutes moving through your body. Start at your feet, tighten the muscles for 5 seconds, then release completely. Move upward, calves, thighs, abdomen, chest, hands, arms, shoulders, face. This sequence reduces tension, lowers cortisol, and helps blunt that early morning pressure surge. Third, and this may be the most underestimated of all, social connection. This is not soft advice. Research has shown that socially isolated older adults have higher blood pressure and faster arterial stiffening. Loneliness increases inflammation, it raises cortisol, and both directly damage your vascular system. So if isolation is part of your life, one meaningful social interaction per week is not optional. It is medical. Now bring everything together. High blood pressure is not just a number. It is the result of 3 forces. Damage to the endothelial surface, driven by blood sugar and inflammation, magnesium depletion, silently tightening your arteries, chronic stress, keeping your system in a constant state of activation. Medication helps manage the pressure, and that is important, because uncontrolled blood pressure leads to stroke, heart attack, kidney failure. But medication is a bridge, not the destination. The destination is a body where your vessels can relax, where your endothelium is repaired, where nitric oxide flows, where your nervous system can return to calm. And that is something you can begin working on this week. So before you move on, choose one step, just one, the one that made the most sense to you. Start there and build from it. If this helped you understand your body in a deeper way, leave a comment, share your thoughts, and let us know what step you are starting with. If you found value in this, like and subscribe so you do not miss what comes next.